Healthcare in the remote community of Thursday Island. The following is a short movie put together by 5 young developing health professionals about healthcare within the remote community of Thursday Island, which aims to identify and address issues faced by health practitioners working and living within this community. Let's begin with a brief background about the community. Thursday Island is a commercial centre of the Torres Strait Islands located 35 kilometres north of Cape York Peninsula in far north Queensland. It is home to roughly 2,600 people, of which 64% identify as Torres Strait Islander. The main language spoken on the island is a combination of English and the Torres Strait Creole, also known as Yumpla Tok. The island has a relatively small area of roughly 3.5 square kilometres, so most of the transport is either by walking, 28%, or driving, 30%, with limited public transport available. The services available on the island include both primary and secondary schools up to Year 12, as well as the Tropical North Queensland Institute of TAFE, James Cook University and University of Queensland distant facilities, an IBIS supermarket, chemist, news agency, FPOS facilities, a National Bank of Australia, Australian Post with Commonwealth Bank facilities, 2 churches, police station, a council library, several hotels and pubs, and direct retail shopping from Cairns using freight service for delivery. Recreational activities Thursday Island has on offer include sporting clubs and facilities such as tennis, pistol shooting, football, aerobics, basketball, netball, boating, fishing, hash house harriers, canoeing, swimming, island tours and cruises, Torres Shire Council Sporting Complex, Maritime Museum, Historic Cemetery, Green Hill Fort, Gab Chatui Cultural Centre, Quetta Memorial Museum, Cathedral, and camping. Thursday Island's industry consists mostly of pearling, fishing, and tourism. However, the 2012 census lists professionals as the main occupation at 22% of the workforce, which is likely to do with the 2 healthcare facilities located on the island providing a number of jobs. The Thursday Island Hospital and Thursday Island Primary Health Centre provide services to Thursday Island and all other surrounding islands of the Torres Strait. The hospital is a 38-bed facility providing emergency care, general medicine and maternity services to the locals. The Primary Healthcare Centre provides a range of services including oral health, palliative care, diabetes and nutrition, as well as health promotion and healthy ageing. As the community of Thursday Island is largely Indigenous, culturally there is a difference in the delivery of service to this population. Indigenous Australians possess a different view of the term health, which is based on the cultural and spiritual well-being of the community, rather than the individual health status. Therefore, for health services to be effective within the community, they must be culturally appropriate and specific to the community in areas such as communication. Due to a lack of resources on the island, healthcare professionals may be forced to be flexible in their services and provide healthcare which is outside their regular scope of practice.
Despite efforts to improve both health and recreational services on Thursday Island, a significant proportion of the population still suffer from some form of adverse health issue. Such health concerns from this area may include mental health disorders, drug and alcohol dependencies, cancer development, and also injuries sustained from violence or high-risk associated activities. While these conditions all require attention and careful consideration regarding their management, there remains a clear health issue responsible for the population's increased rate in morbidity and mortality. An increase in westernised food intake in conjunction with a reduction in exercise has led to a number of people on Thursday Island being diagnosed with symptoms related to preventable diseases which could ultimately cause death. The impact of this poor nutritional control has been recognised among much of the population in causing a greater incidence of chronic illnesses, including obesity, diabetes, and cardiovascular diseases. For instance, the prevalence of type 2 diabetes in the Torres Straits is 3 times higher when compared to the general population of Australia. While it may be simple to demonstrate the seriousness of the health issues which may arise on Thursday Island, there are also a number of challenges which must first be overcome when applying appropriate methods of healthcare to the population who reside there. Unfortunately, Thursday Island hosts its own hospital which facilitates both patients and an array of various health professionals, which has achieved greater health outcomes for the population here. However, access to the archipelago requires transportation via both plane and ferry, which cannot always be relied upon due to certain circumstances such as weather or mechanical failure. This could cause visiting health professionals to face difficulties adapting to varying schedules and also interfere with arranged meetings with an individual who suffers from a serious illness. The implication here is that some individuals may not be able to receive the healthcare they need for their specific condition, while others may go undiagnosed for an even greater amount of time.
As a dentist working in a remote island community such as Thursday Island, a number of professional management issues are likely to be encountered which may affect the standard of healthcare that can be delivered. As the dental facilities on Thursday Island only consist of a clinic within the primary healthcare centre, there is likely reduced access to equipment and facilities. This may result in a reduction in the clinician's ability to perform usual tasks and force referral to the private sector to complete treatment. As well as this, although there is some access to specialist care available on the island, some of the services are provided by visiting professionals, meaning that they are not available year-round. The typical scope of practice of many health professionals working in these areas may face pressure to expand and cause undue stress to staff as a result of a lack of either equipment or appropriate healthcare workers. For example, if a patient attends a primary care clinic with a tooth that requires extractions and there is no dentist present, there may be pressure for the treatment to be undertaken by a medical practitioner despite there being a lack of adequate training. Cooperative teamwork in remote areas can be difficult due to a high staff turnover rate, the presence of cultural and language barriers in the workplace, and problems that arise due to differing opinions. It is essential that professional working relationships are maintained to ensure the longevity of staff employment and the successful implementation of available resources. As you are moving into a new community, it can be difficult to grasp social and cultural changes related to your dental practice. There may be limited access to professional and cultural support in the form of a mentor. Minimal access to continuing professional development opportunities, which may only be available in urban areas, can also be an issue. As well as this, there can be difficulty maintaining confidentiality and anonymity due to the small population size.
To provide successful and holistic healthcare to the people of Thursday Island, it is vital to utilise a number of strategies to overcome the practice management issues previously mentioned. To address the issue of expanding scope of practice, dental practitioners must develop clear guidelines on which procedures can and cannot be performed by respective health professionals, develop more advanced clinical skills which would not normally be required by dental practitioners operating in an open setting, as referral to specialists is limited. They should also utilise third-party education resources such as telehealth, in order to provide specialist guidance to practitioners to allow such procedures to be performed confidently and correctly where absolutely necessary. In order to address issues related to teamwork and its associated challenges, dental practitioners must develop an interdisciplinary approach to healthcare. In order to make this possible, a clear hierarchy of decision-making must be set out. Dental practitioners must also develop communicational skills, both professional and cultural, to facilitate cooperative engagement between different health professionals. Dental practitioners must also understand each individual's role within the teamwork philosophy, acknowledging and utilising the expertise of other team members. Dental practitioners must also develop teamwork traits and skills such as trust, empowerment, leadership, delegation of tasks, innovation, creativity, and risk-taking. In order for dental practitioners to obtain professional and cultural support, it could be useful to seek professional and cultural mentorship. This is essential for overcoming communication and cultural barriers which may cause difficulty in providing treatment. Sources for professional mentorship can include experienced health professionals from other disciplines and dental health colleagues on a local level, or from organisations such as the ADA on a broader level. Cultural mentorship can include consultation with local community leaders and Indigenous health workers. Further strategies to obtaining professional and cultural support include developing professional support groups, as well as getting to know the community. To address the problem of lack of professional development, it would be useful to utilise interactive online educational resources to ensure continued professional development. To address issues regarding confidentiality, there are a number of strategies which a health professional could take on. These include holding appointments in a private location, keeping good clinical records, learning to manage sensitive conversations, and setting initial boundaries and standards for care.
Personal issues. There are many issues that a health worker will encounter when practicing on TI. Many of the services and facilities available in cities and towns are not accessible or available on the island, and this may lead to health practitioners having to adapt to new social and physical environments with infrastructure that varies from what they're used to having. Many of the challenges faced will be due to variations in daily living that form from living in a remote community. Climate. Thursday Island is very humid and can reach high temperatures. This may be confronting for health specialists from areas with milder climates. Transportation. Thursday Island has very limited public transport, especially in comparison to large cities. Primary means of commuting is by foot or car. Communication and cultural differences. It can be difficult to integrate into the small, close-knit community. Customs and practices will vary drastically from metropolitan areas. The people of Thursday Island have distinctive characteristics, beliefs, and customs, and communicating effectively with Indigenous patients requires varied strategies that a dentist from a metropolitan area would not be accustomed to. It may be difficult to recognize and participate in a culturally safe manner. An inability to do this may lead to alienation from the community. Language barriers exist, and an inability to overcome difficulties in understanding may lead to poor treatment as patient-dentist communication is insufficient. All these issues can lead to diminished opportunities to actively engage in the community and can subsequently cause social isolation. Social isolation. Homesickness arising from living away from family and friends. Professional isolation. As a dentist in Thursday Island, face-to-face communication with other dental professionals will be limited in comparison to metropolitan regions. Lack of other experienced dentists to provide assistance may cause stress in a newly graduated dentist when confronted with unusual or complex cases. The lack of professional support systems will create issues during the initial few months of service. This can lead to a lack of confidence and an inability to perform required duties as adequate resources are not available to assist in their completion. Limited resources and equipment. Working in a remote island may limit the infrastructure a metropolitan dentist may have become accustomed to having access to. This may create difficulties in treatment and would increase the workload required to learn new techniques to work with what is available.
Strategies to address personal self-care issues. To manage issues of climate and transport, the best strategy is to adopt a flexible and easygoing attitude to help you cope with these changes. Strategies for communication and cultural differences include getting to know the local community, developing enjoyable recreational activities, engaging in community activities and cultural customs, developing cross-cultural communication skills, drawing on knowledge of experienced health professionals, and developing and maintaining professional and personal boundaries. To address issues of social and professional isolation, dental practitioners should develop healthy relationships with their colleagues and other health professionals, as they can provide a source of support and help you integrate into the community. They should also seek advice from cultural and professional mentors, as well as establish support networks within and outside the community. Further strategies include recording experiences in a journal and being prepared to ask for help and information when required. There will be many challenges in providing adequate healthcare vital to the needs of those living on Thursday Island. In order to do this, it will require the implementation of carefully considered strategies. The ultimate outcome we wish to achieve is to improve the health outcomes of individuals living on Thursday Island and for health professionals to develop on both a personal and professional level. Thank you for listening.
Time over at Johnny's place. Well, this chick got up and she slapped Johnny's face. Man, we just fell about the place. If that chick don't wanna know, forget her.